Omicron variant is fast spreading. Cases confirmed here in India and across the world. Nearly 30 countries have reported cases of Omicron. And amid that, you expect the World Health Organization to lead, to give advisories and tell and really direct governments on how exactly to tackle this threat. But much like what we saw when COVID was first reported, again, the WHO has been making U-turns and flip-flops galore.
The WHO is in line of fire since it declared COVID a global pandemic in 2020. The criticism seemed to have done precious little to make the global body mend its ways in 2021, when the world faces Omicron.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
But it was already too late. China had alerted WHO about the Wuhan virus on 31st December, prompting it to call a global health emergency on 30th January. An independent panel report termed the pandemic 21st century's Chernobyl moment. The panel said that WHO delayed declaring global emergency by at least a week, blaming the delay for world wasting precious time in virus fight. The list of criticism is long. First, it was the over-the-top praise for Beijing's early response to the crisis. Then, wasting a year before barely managing to send in a team of international experts to investigate the origins of the virus. WHO also let China dictate the parameters of its fact-finding mission. It was slammed also by then US President Donald Trump.
One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. The WHO's attack on travel restrictions put political correctness above life-saving measures. The WHO failed in this basic duty and must be held accountable.
Look at WHO's flip-flop on face masks. On April 6, 2020, the WHO said use of face masks was not justified unless other protection measures like physical distancing were not possible. It was not until 5th June that the WHO recommended wearing face masks in high-density areas in regions hard hit by COVID-19. What followed in the weeks to come is the understanding that COVID-19 was airborne. The WHO refused to admit this for several months into the pandemic, even as experts asserted the possibilities. The global health body has also faced criticism for not calling for border closures or halt international air travel to prevent the virus from spreading. The WHO was then panned for its own regulations that travel restrictions should be the last resort. Even today, the WHO speaks against countries shutting down the borders to protect from the new variant. European nations are considering making vaccinations mandatory to contain COVID-19 spread. The WHO is yet to respond. With Milan Sharma, Bureau Report, India Today.